This is the VIP emergency ward that has been set up at King Faisal Hospital here in Kigali. It was decided that the emergency ward should be renovated to include a VIP wing, especially with the way our country hosts different major events, so that it can cater to people at that level, giving them services similar to what they may find back home in developed countries. Private clinics and hospitals like Legacy have also been gearing up for the task at hand. We in the health sector have been preparing for a while now so that we are able to provide the sort of services those who will be coming may need. I say this on behalf of the Legacy Clinic, of course. We have specialists here and nurses too who are all ready. When it comes to logistics, we have ambulances, and I've also set up a state-of-the-art diagnostics center with all the necessary equipment, including an MRI machine, which we ordered and are preparing to receive, as well as a CT scan machine and lab to be able to identify illnesses quickly. At the University Teaching Hospital of Kigali, ambulance teams have continued with their preparations, and officials in the Ministry of Health say nothing is being left to chance, especially with the global pandemic still a threat. We will have teams of doctors right from the airport all the way to the meeting venues and hotels where delegates will be staying. The teams will include specialists, just in case of emergencies. We have ambulances ready and are coordinating with the country's major hospitals, starting with King Faisal Hospital, the Rwanda Military Hospital and CHUK, where we will have doctors on standby. We also have rooms set aside for anyone that may need to go to hospital for tests or treatment. The preparations are also taking into account all sectors that will be involved in such a major event. All delegates will be tested, and there will be a team in charge of that, just like even now we have teams doing that. There is a lab that has been set up to provide results in the fastest way possible. Like the delegates, anyone involved in the preparations and during the conference itself will also be tested. In a broader sense, sectors involved in such important events are also being vaccinated, and by June all people involved in those sectors will have been vaccinated. Also, in cases when a delegate is found to have contracted COVID, they will be isolated in a different apartment or hotel away from the other delegates who don't have COVID. During her recent visit in the country, the Secretary General of the Commonwealth commended Rwanda for the way preparations have been going, noting that such preparedness is what has allowed the conference to be organized in the first place after being postponed last year because of the COVID-19 pandemic.